Hi, my name is Sally Basta. I'm a physical therapist with Cure for the Kids Foundation. We're really excited. It's very rare for a physical therapist to have the opportunity to build something from the ground up, and being able to take from our prior experiences and figuring out what has worked in the past, what hasn't worked from the past, and taken from those to build something brand new has just been super great. We're really excited to build something for Cure for the Kids Foundation, and these kids have a very specific set of needs that need to be addressed, so it's been really fun trying to put those puzzle pieces together. A friend of mine worked with Dr. Brooke Conway-Clevin, who had already started up the program here, and told me that they were looking for a second therapist to come on board. At the time, I was looking for a switch in my career, and I was thinking back to when I was really the happiest when I was treating, and it was when I was treating kids. And I said, well, maybe this will be a really good transition for me, and it really was. I enjoyed my time here. For me, I am definitely more clinical minded, so I definitely see myself taking on the patient care end of things. I'm also really passionate about working with students. I've always really loved teaching and feel that I am good at it, so I would love to bring on students within this program. PEDS is something that I never thought that I would do, and in fact I started PT school saying I would never do PEDS. It's way too sad, it's way too draining, and I have learned to absolutely love it. So I would love to give other students that opportunity to really delve into this world before and if they ever write it off. The patient population here is very unique, and their needs are much more unique than what you'd see in a lot of other settings. You know, one of the biggest differences is a lot of these kids are going to be seen for the long term, and we want to make sure that there is some kind of long-term follow-up program in order to keep monitoring their progress as they go throughout our rehabilitation program. It's not going to be a 3 weeks and you're done, 6 visits and you're done. We're going to follow them for the long haul. I actually decided at a pretty young age, and it was both experience from my parents' end as well as a really good friend of mine. She ended up having spine surgery at the age of 16, and I talked with her a lot about her physical therapy experience and even went with her to a few appointments. Being able to see that side of medicine really inspired me to go into that field. I had originally decided on going to be a doctor and going to medical school, but seeing what PTs do and the avenue that they provide their patients really inspired me to take this route instead. For me, I think what sets me apart from a lot of my colleagues is that I'm very much a yes person, and I have taken on a lot of projects here and there throughout my career that have definitely added a uniqueness to my resume and to my prior experiences, whether that's been setting up a concussion vestibular program with one of my employers to working side by side with our client when we were doing workers' compensation to develop programs specifically for them. So I feel like all of those experiences have really helped me bring to the table what I can bring to Cure for the Kids. I think Dr. Brooke and myself really just want this to be an all-encompassing program that will make it so parents don't have to go anywhere else. We would love to have a full rehab team, eventually branching out to OT and speech, getting a prosthetist on board so that parents feel taken care of from step A to Z.